Yay. Woo! Why does this look so different?
Doesn't it look
oh my
so
gosh,
good?
My hair. I wasn't prepared. I told you let's go live, and then I looked at myself and I was like, "She's a scary,
Look at how
scary
beautiful
little
this
troll."
is.
Have you? I was like, have you been here since like
I
the
don't
redesign?
think so. Or maybe just the lighting is different.
The lighting is different.
Because they were fixing the lighting. I don't know. All I know is it looks superb, and I don't think anything should be changed.
I love this. Welcome, guys, to the Medicare Cafe. Right now,
Pre-chat.
we are just in the pre-chat feature, which is we log on just a couple minutes early to answer any questions you guys have or just kind of talk about whatever the heck we want to talk about. So we're
talking about how tired Olivia is.
I'm exhausted. And you know what? I'll tell you one thing, a lesson I learned.
I'm taking a picture of this. I've never done that.
Isn't that fun?
For my socials.
Oh, do that. Okay, so I actually learned a really hard lesson the other day.
What was it?
So obviously this time of year, Q2 tends to be where like conferences happen. Like right now, Medicare Con is going on. A couple weeks ago was Medicarians. Here in a couple more weeks, we're going to be going to Seven Figure Summit. Like this is where like all the really big conferences all just kind of happen at the same time.
Mm-hmm.
And I go to a lot of them, and I speak at a lot of them, and I get to see, I love them because, like, people who I don't get to see all AEP because we're all, like, keeping our heads down and working. It's like a family reunion, and I love it. At Medicarians a couple weeks ago, I am really trying to correct myself. I learned a lesson the hard way.
What do you correct yourself on what?
So when I see all my friends and I'm talking to them, I saw them Monday. Of course, Monday was a hard day because we flew in. I left Columbia, Missouri at like 5 a.m. Monday morning to get to Vegas Monday afternoon. And the time changes. I was in Hawaii the week before.
Oh, yeah.
I was exhausted. And my problem was I was talking to somebody like, let me guess, you're tired. And I'm like, oh, why would you say that? They're like, every time I talk to you, tell me how tired you are. And I'm like, oh, that's a problem.
Oh.
Like somebody's just like, and like they're trying to be funny and like, cause you know me, I'm like, I give everybody shit, you know. And
but
they was like, let me guess, you're tired. And I was like, I am tired, but why do you think I'm tired? I'm like looking at my makeup, looking at my hair. They said, well, it's because like you always talk about how tired you are. You're always tired.
Those things are like blessings. Like I can't think of what it is right now, but when someone like points something out like that, you realize how much you do it. I don't think you always say that.
Oh, I do. Cause whenever I was walking up to somebody and somebody says, how are you? My go-to response is, I'm so tired. And like, I'm a mom. I have a crazy, career. I have a lot on my plate. But
so are you trying to correct that? Or are you just being truthful? If you're being truthful.
But I think it's kind of like.
Just a habit?
It's my habit. It's a habit. It's a habit that I tell people that I'm tired or like I'm thriving. I'm staying awake. Like I said that yesterday 50 times at our 50th anniversary party that I'm like, staying awake, I'm like, Olivia, you're fine. You're not even tired. Why are you telling people that you're tired? It's just become a habit to me.
That is just hashtag mom life.
I guess
like
so.
working mom life.
But I've leaned into it. I've like,
you know what?
Leaned into telling people how tired I am. You're being
very
nice.
Okay.
I think I need to correct it. And there are times when I'm not, and I'm just telling people, yes, I'm exhausted.
I'll have a subtle word if you say it or something. It's just like watermelon.
Watermelon.
You said it. I'm buzzing.
You ever buzzing? I was like, somebody's more popular than I am.
Both of my phones are buzzing.
Oh, you're very popular. Guys, welcome to the Medicare Cafe. You are joined.
It's top of the hour.
You were joined today by your host. My name is Olivia Richardson.
And I'm Carrie Vogt.
Excited today to kind of talk to you guys exactly. Well, before
we haven't been together since our trip. We haven't been here together. No.
That is wild. What?
We had fun together in Hawaii and finally got to play.
Yeah.
We never get to play.
No, and our husbands love each other. It was truly, Hawaii was an incredible experience.
It really was amazing.
It was my first time in Hawaii, and Kauai was fantastic and beautiful, and like we're dreaming.
The most. So dreamy.
Dreaming of going back.
I already have a question. I love it.
If a 66-year-old has a Medicare card with Part A, how long does it take to add Part B? Lee, that's a funny conversation right now. Usually it shouldn't take, it usually should be you apply for Medicare Part B. You should be able to get Medicare Part B, reflect on the data, reflect on the cards the following month. As long as you're eligible for it the following month, it should be able to that you're getting it. The problem is that we're seeing such delays happen right now.
It's been for the last, I think it happens a lot faster if you already have Part A than if they are applying for both at the same time. It should take about 4 weeks. So what I have been telling my clients to do is I always give them the paper applications. I give them the CMS 40B, and then I also give them the L56 form if they have to prove they have credible coverage. And I tell them to walk.
Casually mentioning these forms off the top of your head's very impressive. I think we need to address that. Okay.
I tell them to take both forms and hand deliver them to the local office. Don't mail them in. Don't leave them at the drop box at Social Security. Give them to a human being in their hands.
Yeah.
And that's the fastest way for it to get processed. I think.
Yeah, I completely agree. Having people
4 business days later, oh my gosh, Brad, that there must have been a unicorn processing that application. That is insane.
Right now, I think you said during COVID, we are still seeing the repercussions to Social Security Administration, to Social Security from COVID, and a lot of offices, you have to schedule times to go.
Yep.
The ability to drop off paperwork doesn't exist because people are not in that office unless you have a scheduled appointment.
Really?
In a lot of areas, yeah.
Small towns must be?
Some, yeah.
That's crazy.
So my mom turned 65 in October, right? So I told her that she has a twin sister.
Okay.
I said, I want to get with you and your sister, my aunt, in April.
Yeah.
Because we're going to be having to actually get you signed up because in some cases it's taking 6 months for it to reflect correctly. So we need to be doing this in April and having these conversations and telling her you got to do it in person. If you go and do this, exactly what you're saying. You don't do it online, go and deliver and try to get a letter in the mail. Or not a letter but from the mail, but something in writing that says your Part B will start October 1st. And she's just but you have to understand what it takes for me to be able to go to the Social Security. Number one, her Social Security office that she's assigned to is a 50-minute drive for her.
Oh my.
So she's so I'm not gonna go drive 15 minutes just to find out that I can't go because I don't have an appointment. So it's tough. It's tough right now.
Speaking of forms, one thing I will say that I feel like a lot of agents forget to tell their clients when they fill out the 40B form, the Part B application, is in the remarks section. You gotta write when you want the effective date. If you don't put requesting future effective date of July 1st, they're going to put it effective the very first of the following month. And they don't want to start paying that $185 until they have to. Yeah. So
great
just
advice.
a side comment.
No, thank you. And actually, Terry just asked a question. So I know you have the RSSA certification. That you actually can be an advisor on Social Security, correct?
Yep.
Terry had a really great question. If you guys have questions about that, we've done a ton of videos in the past about your RSSA certification.
I just shot one with Sadie, which you'll find where, Sadie?
And it'll be on the YouTube page.
On the YouTube
Senior Marketing Specialist YouTube page. Talking about that too. So more videos about that coming up. But Terry just asked a really timely question. Does Terry and Carrie, love that. Does Carrie have an update have to take update classes for all those changes in Social Security?
So you mean like
a continuing education?
Yeah. So there's continuing education I have to get every 2 years. But we also have monthly legislative updates.
Yeah.
So that we can just it's just a monthly meeting with all the RSSA team, all the advisors at the National Association. So sometimes they're just legislative updates. Sometimes it's specific, we're just going to talk about spousal strategies, or we're just going to talk about the windfall elimination provision for teachers that went away.
Yeah, so, that thing that obviously.
Sometimes, but there is a monthly meeting, and so. Yes, I've been really excited for these monthly meetings because, you see so much on the news about Social Security changing, and, there has been no big notice given to us that you need to be alarmed or you need to be worried about these changes.
Oh, wouldn't that be nice if you just got a message just yes,
red alert,
red alert.
So, I take peace in that I will. We have people on the National Association who are right up there with, I don't even know who the big dogs are, but with the big dogs of Social Security. And again, there's been no red alert warning.
I love that. I love DEFCON.
I don't know if that answers your question.
I need
Terry.
if I just get a DEFCON 1, I'm just things are going down. I need you to be my alarm.
I can let you know.
Thank
and we
you.
can have a red alert day.
Thank you.
If I get that on Social Security.
So I want to talk a little bit. Actually, let's kind of keep this going, right?
Okay.
So today we're talking about, this is kind of the segments Medicare Cafe. Number one is talking about industry updates. We're going to talk about kind of your tip of the week, being like, what are you doing right now for quarter two?
Mm-hmm.
And then your question of the week. What's something that we're getting a ton of questions about our agent resources team? But like, we're kind of talking about industry updates right now. So let's just continue.
Let's dive in.
Let's just kind of continue to dive into it. Number one, I think everybody should have saw that the Medicare Advantage prescription drug plans are expected to get about an increase to 5.06%. Basically,
explain that in very layman's terms. Who's getting the increase?
Great question. CMS, we know this. Okay, so CMS basically says this is how much money we're going to give you in 2026.
Per like enrollment?
Per enrollment, right. How much money that Medicare Advantage companies are going to be receiving. Essentially, it's increasing this year 2.84% compared to last year of how much money that Medicare Advantage plan is going to get. What's interesting about that is that's a huge shift because the last 3 years in a row, that amount
decrease
has been lower and lower and lower. Last year, it was like a 3%.
Okay.
A little over 3%. So this year that it's going up so much is exciting that Medicare Advantage plans is going to actually see some movement in the other direction. I think a lot of this you can attribute to the Trump administration.
Mm-hmm.
Dr. Oz has really been pro Medicare Advantage plans. In fact, he was a huge proponent for like Medicare Advantage for all, making Medicare Advantage the default plan. You'd have to disenroll from that to enroll in original Medicare. So it's not surprising that we saw an increase towards Medicare Advantage plans or proposed increase for Medicare Advantage plans.
Yep.
Something though that I noticed.
How does that does that payment to those Advantage plans trickle down to us? Like, how do we benefit from that?
It means
better plan benefits?
Better plan benefits, more rich plan benefits. The Biden administration with the Inflation Reduction Act and everything was really talking about wanting to put a hold on spending and crazy benefits. I mean, like we knew last year there were plans that paid for golf clubs. Like spending got a little outrageous on the Medicare Advantage side. There's a big steps last year to make plans more focused on the healthcare benefits versus all the bells and whistles. There is fear that with the Trump administration and such pro Medicare Advantage that's going to be taking a step back. So you might see some and more colorful, we'll say, extra benefits. I don't necessarily think that's the case though. Okay. Because when we look at the percentage of growth of the Medicare Advantage space, talking about the health, people not getting health care, people utilizing the benefits, how much money these Medicare Advantage plans tend to be losing right now. Yeah. The growth of those plans was over 9%. Of how much income is needed to sustain Medicare Advantage. That growth was up about 9%. So the fact that Medicare Advantage funding is only up 5%, though it is higher than what we've seen the last few years, there's still a significant 4% deficit of it's not keeping up with what the income that's needed to keep those plans thriving the way that they were.
Are there restrictions or guidelines when they say we're giving you this money, you have to use it on X, Y, and Z? Or do they just have
so many? There are so many restrictions. So many guidelines. In fact, there's a percentage, but it's around 80%. It gets into the decimal points. I don't know them. Of money that CMS receives, both via premium and from, or it's not CMS, excuse me, a Medicare Advantage plan. All income that they receive, at least 80% of it, and there's a more specific structure and formula for this, have to go into plan benefits. Some of it has to, will go into administration costs. Some of it will go into commissions for agents. Some of it will go into profit. But over 80% of it does have to be reinvested into plan-specific benefits. Okay. So a lot of things that go into that. But just understand, when you hear...
So ultimately, that's a good thing. We're happy about that.
It is a good thing. I will tell you, though, kind of what we're hearing right now in the industry with a lot of this stuff, and we're kind of going to talk about this when we go into quarter two, is that Medicare Advantage plans, even though, again, they are receiving this increase. On paper, it looks great. It looks like there's this investment into these plans. It's still not keeping up with in order for them to sustain year over year is not keeping up with what they need. And so we're seeing a lot of companies right now really start to look at what's going to look like this AEP in 2026.
Already.
Which actually leads me to the next question going on is, what is AEP? This is one of the top questions our teens are getting. Is AEP really going to be that crazy again? Because we've been talking about that it's going to be like another wild ride. And everybody's like, I don't know how. I don't possibly understand how that could be.
I just don't think it. So is it going to be the opposite? So like last year, when I look back, I think the craziest part was the so many service area reductions. Like that's what stressed me out the most. Is it going to be the opposite? Like with all these new, more funding, maybe Oz has something to do with it. Is there going to be more new plans, new plans, new benefits? No.
Again, the amount of money and the amount of attention and the love that Medicare Advantage plans are receiving are not keeping up with with the cost it is to do them right now, and with the Inflation Reduction Act, with the majority of the population olding and using those benefits more. No.
Okay.
What we're anticipating to continuing to seeing, honestly, you're going to see a lot more service area reductions this year. You're going to see
sweet.
Even more, especially with those plans that went suppressed last year. They went suppressed because they got way more enrollments than they were able to handle. Those plans were basically saying it's going to be way too expensive to insure this many lives. Let's try to slow down enrollment. I'm not saying, I don't have a crystal ball. I'm not saying that they will go SAR, but it's a possibility that we
So are MedSubs preparing for that?
MedSubs took it
because they probably didn't
prepare
for that last year.
I'll say it like this. I have Mutual of Omaha.
I don't know how you prepare. Necessarily.
Let's talk about MedSubs here in a little bit because that's actually the tip of the week is talking about those Medicare supplements. But to answer your questions, obviously when there was an SAR, that means that they're guarantees you for Medicare supplements, right? When you have 3 tumultuous, I've been practicing that word.
Good job.
At least 2 tumultuous going on to the 3rd Medicare Advantage seasons, AEP seasons in a row, especially to those people who are new to Medicare. They don't have the loyalty. They haven't been on this plan for 10 years. They have much less loyalty. They're much more likely to jump back onto a Medicare supplement. If they can do so, guarantee issue.
Oh, yeah.
We saw that a ton in 2025, and the Medicare supplement market struggled. Now, some of your we'll talk about it here in a second. I said we'll talk about it in a second, and then I'm like, no, Olivia, I'm going to talk about it now.
Let's answer this question. So the increase in Medicare payments, does that mean a delay again this year in the plans coming out with their plan features because of the competitive issues we dealt with last year?
I know, Will. I remember you from last week, Will. Will was asking a lot of these questions too, but like, can we expect to see, because that puts so much strain as us on agents.
Oh, yeah.
To be able to be like, usually by August, early August, we're able to kind of say, okay, who are my problem children? Who are the people that are going to need my help immediately, because I know exactly what those benefits are going to look like. We didn't get that this year. And William, again, I can tell you, I don't have a crystal ball. I can tell you this will be another year where carriers really keep their benefits close to the chest.
Okay.
Because again, what we saw last year was a correction. When we saw last year with Medicare Advantage plans was, we don't know how this is going to shake out.
Right.
We don't know. We want to be competitive, but we don't want to be overly competitive. So, and everybody kept it close to their chest. So I think, and I think carriers got it wrong. In a lot of areas, carriers got it wrong. That's why you saw plans mid-AEP go suppressed, and why you saw carriers mid-AEP go non-commissionable, because they got it wrong. I think you're going to see the exact same thing this year, where carriers are now going to try to correct what they had during AEP. We're not seeing a ton of like the IRA and inflation, all of that stuff. There's a good cooling period this year. Right, next year, all they're talking about is just negotiating the top 10 most expensive medications. So that does happen in 2026. So that will have an impact, but nothing as severe as what we saw with the max out of pocket on Part D. So you won't have that much.
Do we have the list of the 10 drugs yet? Like, is it confirmed?
I don't know that it's confirmed. Chaylin does have a list. I will make sure we can get that to everybody. Yeah, but it is talking about how like carriers are going to be correcting because some of them just went too hard in the paint this year. And I will tell you, it's going to be incredibly important. We said this last year. It's going to continue to be incredibly important for you to make sure that you have what we call the share of shelf. We said this last year. It proved to be true.
Share of shelf?
I imagine it's going to continue to be proven.
Share of shelf.
You will not be writing just one carrier.
Oh, got it.
During AEP.
Oh, man, I experienced that.
Yeah. Usually in the past, you'd be like, oh, all my people are going to go on Aetna. All my people are going to go on UHC. All my people are going to go on Humana.
They
did
were
not
more
see that
spread
this
out.
AEP. You saw a lot more carriers enter the mix, and you're going to continue to see that in 2026.
I can get on board with that.
Right. It's not a bad thing, right?
No.
Don't put all your eggs in one basket.
Yeah.
You won't be able to.
Yep.
Just continuing to see that. And so to answer your question, Will, yeah, I really do. Do you mind if I call you Will? Your screen name says William. But William, I feel like we're friends. I'm going to call you Will. Unless you tell me not to.
She's reaching out, shaking your hand right now.
It's nice to meet you, my buddy. My good old pal Will. We go way back.
Yeah, you go way back. Till last week.
Till last week. But yeah, I can't expect to see a lot of carries again because they're making such intense corrections. Hold those plan
ready
details
for it. It's
the
nothing
chest.
we've never faced.
It's just another
It's
year.
old news.
Who is that, right?
Old news.
So let's talk a little bit more about Q2. Yes, AEP is going to be another madhouse in AEP. And so what can you be doing today to help prepare yourself for that? Honestly, I have it up there, but just get into practice, build your habits now, try new things, make mistakes now, learn.
Figure out what works and what doesn't.
Figure out what works and what doesn't, because Q3, you're going to be in planning mode. You're
Hone
going to
in
be
on your efficiencies.
Every Q2 is Q2 is kind of like the vacation time.
Yep.
And it is the practice new things time.
I agree.
What have you been up to? How's your first? We are 14 days in. What's today's date? We're 15 days into Q2. What do you got going
on? Well, if I'm being honest, I had the best first quarter of my life. So I've been slow. Yes, business wise.
So why? Yep. What happened? I mean, we know for a lot of people, OEP was nuts. But what were you doing in Q1?
It wasn't OEP. I think, when I first started as an agent, I knew that me not cold calling, not door knocking, not doing the traditional ways of marketing my business. I knew that laying the foundation of building my strategic alliances, my networking partners, it wasn't going to be an immediate turnover.
Yeah.
And I just truly think it took 5 years for it all to really just I don't know, build on each other. Sure. And so I just had a ton of, I think I used OEP twice. Yeah. And I've had 40 some new clients this year. And so they're all just T65s.
Are most of them going the Med Sup route? Mm-hmm. Because you have a lot of your financial planner people.
Yeah. And maybe this goes with our Med Sup conversation, but maybe I'll save that for the Med Sup conversation.
Well, let's get into it. Again, I know our time is valuable. I want to make sure I'm responsible, but and respectful, right?
Yeah.
But that's what a question, when I said top question of the week, I ask our agent resources team, our key accounts team, what are agents asking us? What are they reaching out to us? Where are they asking for our advice? And this was overwhelmingly, everybody's just kind of
How can you keep writing supplements?
About Medicare supplements and saying, I don't know that I in good conscience.
Mm-hmm. Good conscience?
I'm working really, really hard. I'm not tired, though. I got tumultuous. Yeah. Today was a win.
Total win.
Okay. So how can I, in good conscience, write this product, right? And, I'm just thinking about my wooden leg comment yesterday. We don't have to go into there. And then how do I get people to want to buy this when there's a $0 option over here that covers stuff? This one's going to cost my client $250 a month.
Yep.
And with no side of slowing down, what do I do with it?
So I haven't personally seen any of that panic. And I think the reason for that is I don't really sell on the numbers. When I go over all the pieces of Medicare, and then I go over the pros and cons of each side. And I'm like, okay, do you pick your health insurance because you like having dental, you like having vision, you like having those extra benefits, you like saving money up front? Is that what you're looking for in your health insurance? Or are you looking for a nationwide network? Are you looking for concrete, finite? I know my only out-of-pocket expense is a $257 deductible. Are you looking for a plan that has no prior authorizations, that you've got the green light no matter what your doctor says that you need, as long as it's medically necessary, you've got that green light? I think I hone in on the style of the plan before we focus on the money.
Yeah.
I don't know, and maybe I'm I mean, yes, like I do have more affluent clients, but the majority of my clients are still like
middle class.
Yeah, like they're
Yeah.
still in the lowest IRMA. Like they're
Yeah.
still paying the 185.
Yeah.
Like I have, maybe 10% of my clients that are very wealthy,
Considered
paying.
wealthy.
Yeah.
Like by the numbers considered wealthy, sure.
And they just, they say, well, I sleep better at night knowing that I can go wherever I want because we travel. And the nationwide network and no prior authorizations fits better with me than, oh no, what if I get a denial? And what if my doctors are in and out of network?
Well, I think too, it's like, I think it's a really good reminder. And if we do shorts, we should clip exactly what Carrie's saying here and make sure people hear it. Because two things. Number one, where is the panic coming from, right?
Yes.
Are we as agents seeing the industry and seeing everything and knowing what's coming? Are we creating panic in a world where like consumers are okay with this? Consumers, as long as they understand it, I think more importantly, as long as they have the right expectations.
Yes.
Having the right if you're giving them this plan and saying this is what you're going to pay, you're never going to see another dime, and then next year they have a 10, 20, 15, whatever percent rate increase, then yeah, that is going to come as a shock and their expectations aren't met. That's where people get upset.
Yep. And that's exactly how, like, if they pick a supplement, I say, okay, so you're picking, this is going to be more expensive up front. These, the plan benefits of an A, B, and G, those haven't changed in 20 years. And the plan benefits shouldn't change in the next 20 years, I hope. But your premiums are going to go up each year. And I go over the whole thing of, last year and this year, we're seeing double-digit rate increases. So, these might go up. But if in 5 years from now, if this gets too expensive, then you can try out that Medicare Advantage plan. But if you start on this Medicare Advantage plan, you might not in 5 years from now be able to switch back if you're unhappy with it because you'd have to pass the health underwriting at that point. And so it is just about being transparent.
It's just transparent and just like giving them all the options and letting them make that decision. You're guiding their decisions, but like by education, not because of your own like biases and things like that. So number one, making sure you have the right your clients have the right expectations about like what does paying for a Medicare supplement plan look like. But I think number two, and you're hitting it on the head, I just want to say what you're doing is you are not selling based on convenient measures. And by that, I'm saying like dollars, right? When we're selling insurance, we're advising on insurance. You obviously budget's a lot. Budget's not everything, but budget is a lot that we need to be. It's like we can't be showing them a plan that's going to cost $5,000 a month whenever we know that they have a budget for $200 a month. Like don't be cruel. But you have to make sure, again, understanding you have to learn from them what's important to them and then help guide their decisions based on what they value, what risk they're comfortable with. And on honesty, it's kind of forcing us more into an advisor role versus a shopping role. They can go anywhere and buy insurance on Google. They can call a call center. They can do, it is not a unique capability to sell insurance. It's just not. It is a unique capability to help guide people into making decisions that fit their lifestyle, fit their comfort level, and fit their wallet. So I think what that does, it forces or really kind of forces our hands to become better advisors, not order takers.
I have the same like presentation, whether someone is in the highest IRMA bracket or they are in the lowest or they are just living off of Social Security alone. And based on what they tell me, I'm like, okay, so like the finance of this is what stresses you out. You aren't comfortable taking that risk of paying that much money. Let's look at a Medicare Advantage plan. This is less risky for you because you're saving $165 a month. But do you understand, you might have to meet this out of pocket or you might have small copays as you go. And they're like, yes, I'm fine with that.
Something I'll mention that you might want to make sure you're taking a look at is if you are wanting to consider and continue to write Medicare supplements, consider, again, do you understand your Medicare supplement clientele? Man, that works so perfectly with your stories and what you're talking about. Two things I'll add to that. Underwriting is key, especially in states that are becoming out. We're getting more and more states with birthday rules, anniversary rules.
More are
adopting that all the time. I know.
No way.
Yes, there was another one that was just announced. I'm actually meeting with Christy from Mutual of Omaha
next
door.
I didn't know that.
She was talking about how like they're getting calls like from agents like how could you allow this to happen? And she's
why is that a bad thing?
It is a bad thing. What that typically means for and it's not on paper.
I mean, just because of commissions?
Commissions and premiums. because the actuaries have to now have. If you look at like Missouri's
They're going to
premiums,
increase their as opposed to
look at
Kansas.
Missouri premiums versus Kansas premiums. So in Missouri, our premiums are higher, our commissions are lower. In Kansas, premiums are lower, commissions are higher.
But see, I see it as there's more opportunity.
Always see it as more opportunity.
Because if someone comes to me and they're paying $200 for their med sup, oh, well, on their birthday, I can switch them because they're my client. I can get them to be my client.
Well, and everything's an opportunity.
Right.
And always keep that mindset. Everything's an opportunity. On the other side of that, though, you now have to work, and you are so good about taking care of your clientele. So not Carrie. Take Carrie's name out of it. A new agent or an agent who maybe isn't new but doesn't have the bandwidth. They have, 600, 700 clients. They don't have the bandwidth to be in front of their clients every single month. Think of it like this. I now have to there's so much opportunity for another agent to come in and take over my clients.
True.
Because it's the barrier of somebody taking my client. So I now, instead of being able to actively go and get new business and actively go and help more people, have to do a lot more work with my current book of business, which can really slow down my growth.
Yeah, I hate doing Moji reports.
Exactly.
I do hate that.
And so because of this, again, lower commissions, higher premiums in these areas, in these circumstances, because the med sup companies want to do business there, but they have to be able to afford to do business there. So that's what's required.
Are the rate increases? I haven't even looked at this, and I should because I have several clients in other states. But are like the rate increases in Kansas lower?
Yes, oftentimes, yes, because they don't have to compensate for an influx of business they didn't expect. That's why in states like Missouri, California, you'll see a lot more frequent submission of new paper. We're like a Mutual of Omaha or something like that will come in. They'll say we used to be United of Omaha, now we're Omaha Insurance Company. We're gonna sunset this book of business. We have new paper we're gonna have over here. It's just because again, like this book of business has gotten too expensive. We still want to do business here, so we're gonna launch a new company here. And again, you see that'll happen a lot more with states
in birthday states
because you just can't control your loss ratios in those guarantee issue states. So what you can be doing to make sure, that you still help as many people as you can and still receive great commissions. Number one is underwriting early. Missouri, it's policy anniversary. So if their policy anniversary is October, see them, going into August, see them going into July. It's like trying to underwrite them into a plan. If they can't underwrite into that plan, go ahead and use Missouri guarantee issue. Yep. During that time, no harm, no foul. They get to keep the book of business healthy. You get a higher commission. Number one. And then number two is making sure that you are getting more. I would say it used to be like when you did a med sup pitch, it was, okay, here's a G. Maybe you quoted an N every now and again. I think we're just going to have to maybe change our Medicare supplement pitches. High deductible Gs.
I've definitely been doing that more. Talking about Ns and high deductible Gs.
Yes. I think it's like, it's just, once you find out they're going the med sup route, then you kind of have to start a new pitch of like, here are the three options. Most of the time, here's your three options. Most go with G. We're going to kind of lean that way. Yep. I think you have to give more attention and more education about the high deductible G and the plan in, because those aren't seeing the rate increases that we are for others.
Yep. When I see somebody being torn, that's my initial go-to is high deductible G and N.
Yes. So that's what we can be doing, again, to make sure that clients are able, one, understand who is a med sup client.
Yep.
Understand why clients are still buying Medicare supplement. You got to understand that first. Make sure that you are underwriting for the sake of your business, for the sake of Medicare supplements. Underwrite when you can. Now, if somebody is in their guarantee issue, right, they are guarantee issue, you cannot do not underwrite them.
Right, you can't underwrite them.
No, do not underwrite them. That's why we're saying get to them before they're in their guarantee issue window. Underwrite them then. Once they're in it,
but
don't.
You can. I did this. If I had someone who was going to Moji to an F, they were switching companies F to F, but I was like, you're super healthy. Let's underwrite you to a G.
Yeah.
So I could do that.
You could do that. In Missouri, you can, but in other states, it's like to lesser. So if they went from an F to a G or a G
you couldn't
to an
do that?
N, they would still be considered guarantee issue.
Interesting.
So just timing is everything.
Okay.
Understand their rules, and do so compliantly, and make sure if it's not in the client's best interest, stop right there. Do what's in the client's best interest. But it's always nice to try to underwrite them when given the opportunity. And then again, number three, just make sure that you are including high deductible plans
For sure.
and Plan N.
And a lot of plans give underwriting bonuses.
A lot of plans will give underwriting bonuses, especially those ones that are integrity led.
Oh, really?
A lot of them, the Medicare supplements are doing a lot right now for trip incentives, bonuses, things like that, and guarantee issues and things like that have been almost completely taken out of the equations for that. So underwrite it when you got them.
Any texts that we got? Text
Maybe.
questions?
I did see a couple, but we did answer them as we were going.
Okay.
But again, guys, we appreciate you all for hanging out with us today on Medicare Cafe. It is 10:31, so I want to make sure I respect everybody's time and get us out of here. But any final questions, comments, concerns, threats, or promises, put them in the question chat or shoot me a text. Again, even if you're watching the recorded version of this, text me back at any time. I always try to make sure I respond at least within same day or within 24 hours, Monday through Friday. So that is my real phone number. I have had several people text me like, okay, robot. And I was like, not a robot.
No.
Not a robot.
This is you.
I cry a lot more than robots probably do. I also saw, we have a conspiracy room. You know what I'm talking about, Sadie? We have a conspiracy chat room. They are teaching AI robots how to, like, Kung Fu.
Oh my gosh.
Martial arts.
I don't know what I think about AI.
I have a lot of thoughts on AI.
I have a lot of thoughts.
However, we did also, so AI, good and bad. Fighting robots, probably bad.
Probably bad.
But I did put a picture of myself and my dog, and I had as like, what would my dog look like as a human and me like a dog?
What in the world?
And
who does that?
Like
and why are there apps that can do that?
Well, listen, it is what it is. I was a lovable scamp.
On that note,
you don't want to hear more about me as a dog? I was kind of like a yellow lab mutt with spots.
Somebody once told me I'm like a golden retriever puppy, and I don't really know.
No, it's like you're high energy and
Am I high energy?
If you were a dog, how would I describe? You know who I think you'd know? No, I take it back. I think
I'm so bad at dogs, so like I think I know what a golden retriever is.
You don't know what a golden retriever is?
I think I know.
Think dog. Like just dog.
Just dog.
Like
just think
with fuzzy
dog.
Ears and tail.
I'm so bad with dogs.
I feel like you'd be
A bunny.
A bunny.
I think should be
A bunny, not a dog. What kind of dog would you be? A rabbit.
A rabbit.
Not a rabbit, a bunny.
A bunny. What kind of dog would I be? This is a fun
Happy
game.
Easter, guys.
You're right. It's time. All right,
From
guys.
your bunny.
So until next time, have fun
Make money
and give impeccable service. Thank you, my friend.